Hi everyone, we're the members of No Disease Left Behind, and today we will be presenting on sickle cell disease. So first, I will be going over what sickle cell disease is. So sickle cell disease is a genetic illness that happens when people's hemoglobin turns abnormal in their red blood cells. Hemoglobin are necessary and they help carry oxygen from the lungs to the cells throughout the body. Red blood cells are normally disc-shaped and flexible so that they can move easily throughout the blood vessels. However, when this hemoglobin turns abnormal, it is called hemoglobin S. The hemoglobin S gene will cause hard protein strands to form within the red blood cell and will change the shape of the red blood cell. Now the cells are sickle-shaped, aren't flexible, and will stick to blood vessel walls. The cells will not be able to move around as easily anymore and will get stuck and stop blood flow. The red blood cells will not be able to help carry oxygen as well anymore, and oxygen will not reach different parts of the body, which can result in pain in the patient. Furthermore, sickle cells die earlier than normal red blood cells, and this will cause a constant shortage of red blood cells and result in low energy in patients. Now next, I'll be going over how a person can get sickle cell disease, which can be demonstrated with this picture. So here you can see that sickle cell disease is inherited, which means parents can pass it on to their children. To have sickle cell disease, a child will need to inherit the hemoglobin S gene from both parents, which you can see happening to the child on the right. However, if a child inherits the hemoglobin S gene from one parent and a normal hemoglobin A gene from the other parent, the child will have the sickle cell trait. This means that the child will likely live a normal life and not have any signs of the illness, but they can pass the trait to their children, and this can be seen with the children in the middle, whereas the child on the left receives both normal hemoglobin A genes and does not have sickle cell trait or the disease. And now here is a picture explaining which people are affected most by sickle cell disease. So as you can see, African Americans are affected most, with Native Americans next, then Asians, then Hispanics, and then Caucasians.
So a normal healthy red blood cell is going to be round and flexible. That shape is perfect. It lets your blood move smoothly throughout your entire body, getting blood and oxygen to your brain and all of the other body parts. But in people with sickle cell disease, the red blood cell changes shape and it becomes bent in the shape of a sickle, which is not nearly as flexible. So these sickle cells can build up and actually block your blood from flowing, which can be dangerous if not taken care of. In the United States, about 100,000 people actually have sickle cell disease. Most people that have it are of African ancestry, but it's also relatively common in Native Americans. 1 in 13 African Americans are born with at least one sickle cell trait, which makes them carriers of the disease, but they may or may not have symptoms. On the other hand, 1 in 365 African Americans inherit a sickle cell trait from each parent and are born with sickle cell disease, meaning that they have symptoms. In Native Americans, 1 in 2,700 are born with the disease. The disease is less common in Asian Americans and Hispanic Americans, which are 1 in 11,500 and 1 in 16,300 respectively. So what happens if you actually inherit a sickle cell trait from each parent and develop the disease? On to the next slide. So some early signs and symptoms of patients with the disease include swelling of the hands or feet and yellowing of the skin. They'll feel tired and might even have a fever. They also might feel thirsty, stressed, and breathe faster than normal. But after a while, some complications of the disease may develop because of the lack of oxygen, which we will see on the next slide. Sickle cell disease can lead to recurring pain episodes known as pain crises. They usually happen in the area around the joints and can range in severity. In children, these episodes are separated by a pain-free interval, but in adults, the pain often will continue nonstop. Aside from this pain, sickle cell disease can increase infections, delay growth, and even lead to damage to body parts like the brain, lungs, heart, and bones. On the next slide, we'll talk a little bit more about what we can expect. Usually, the early signs and symptoms of sickle cell disease will start to show up when the patient is around 5 months old. When that happens, the symptoms that I mentioned earlier can range from being not too bad to a little bit more severe. A person with sickle cell disease typically lives around 42 to 47 years, but by working with their doctor and taking good care of their health, the patient will be able to live a long and full life. As a side note, women with sickle cell disease actually generally live longer than men for reasons that we still don't know yet.
So why should someone get screened for sickle cell disease? Getting screened is important because sickle cell disease can be passed down to children through their parents' genes. Screening should occur for all newborn babies, even if they look healthy. If left undetected and untreated, it can lead to severe health problems and even death early in childhood. In the US, babies are screened for sickle cell status as a part of the routine newborn screening program. In adulthood, screening for sickle cell status may be done as part of the care you and your partner receive before or during pregnancy or after your baby is born. The best test to tell whether you or your child is at risk for having sickle cell disease is a complete blood count test, which screens for anemia, which is a condition that occurs when not enough oxygen is delivered to the cells of the body due to presence of abnormal hemoglobin. Furthermore, DNA testing may be used to find out the type of hemoglobin present in a person's blood. Although there are no preventative measures for sickle cell anemia because it is a genetic disorder, one can prevent complications through safe daily practices. Washing hands is one of the best ways to help prevent getting an infection. People with sickle cell disease, their family, and other caretakers should wash their hands with soap and clean water several times each day. One should always remember to clean their hands before making food and eating, after using the bathroom, blowing your nose, and touching people or things that can carry germs. For food safety, a bacteria called Salmonella in some foods can be harmful to people with sickle cell disease. When preparing food, one should always have their hands clean as well as the counter and utensils after touching uncooked foods. Vegetables and fruits should be rinsed well before eating, and meat should be fully cooked, and raw and undercooked meals and eggs should be avoided. Although there are no vaccines available for sickle cell disease, vaccines for other diseases are a great way to prevent other serious infections. Children and adults with sickle cell disease should get all recommended vaccinations, including the yearly flu vaccine. Furthermore, people with sickle cell disease are considered high risk for certain infections and should get vaccinations for pneumococcal and meningococcal as well. Antibiotics are drugs that are widely used in the treatment and prevention of infections. Children under 5 are recommended to get a prescription from a doctor for antibiotics to prevent infections that can be deadly to young children.
As for medicine and what your doctor do to help people with sickle cell disease, there are actually many options. There is only one cure though, and this includes a bone marrow transplant. A bone marrow transplant first starts with chemotherapy, and then the patient's bone marrow is replaced with blood-forming stem cells from a healthy donor. This results in new red blood cells that are healthy. This is so the red blood cells can grow to be strong and multiply. The best person to get blood from usually is family members because their genes are most closely related to yours. Another option is transfusion of blood with healthy red blood cells to a sickle cell patient. This is called blood transfusions. Blood transfusions are given either chronically to manage symptoms or acutely to manage disease events like strokes, but it is only a management strategy. There are also ways to help with the pain. Some options for mild pain include Advil or Tylenol, which can come over the counter, versus ketoconazole and tramadol, which can be prescribed by your doctor. There are also pain injections for severe pain, and as for painful episodes, which are also called painful crises, doctors recommend hydrating and also receiving pain pills and injections like morphine. And lastly, there is also a drug called hydroxyurea, which is currently the only drug that is approved by the FDA. Hydroxyurea is the only FDA-approved drug, and it comes in a capsule for people who have at least 3 painful episodes in the past year. It works by increasing the oxygen on red blood cells and reduces the sickle cell-shaped blood that sticks to the blood walls. It helps by reducing the need for patients to get blood injections, along with helping with chest pain, cough, and fevers that may occur. Side effects include skin problems, headaches, fever, and asthma. Your doctor will also have to check your blood every 2 weeks on this drug. On the next slide, we have actually a picture of this drug. Now, to find more information on sickle cell, you can actually visit the Centers for Disease Control website on sickle cell disease or contact your local doctor. Thank you for listening to us, and we hope you were able to learn more about sickle cell disease. Please feel free to visit our Facebook page where you can find more information on other rare diseases.